Like with many jobs, there are a lot of pros and there are a lot of cons when choosing a specific position. And as a nurse, there are so many different specialties out there, and now you just have to outweigh the pros versus the cons and trying to determine whether or not you should take that position. And honestly, psych isn't for everyone. There's so many different pros and there's so many different cons. But in this video, I'm going to be going over the pros and cons of being a psych nurse, so stay tuned. Welcome back to another episode of Life of a Psych NP. If you are new to this channel, let me formally introduce myself. I'm Darty. I'm a board-certified psychiatric nurse practitioner, and in this channel, I go over several different subjects to educate the public about mental health, ways to improve your lifestyle, topics related to nursing, nurse practitioners, and how to start and grow your private practice in mental health. So if you are interested in any of these topics, feel free to subscribe. Make sure you give this video a big thumbs up because it helps so much with the algorithm. Make sure you smash that like button like so many other YouTubers say, because it definitely helps me out and it actually motivates me to want to make more videos. So make sure you like this video and make sure you follow me on Instagram at LifeofaPsychNP. So you probably clicked this video because you want to find out what are the pros of being a psych nurse and what are the cons of being a psych nurse. I know I've made two different videos going over the pros and cons, but I figured I'd make a video combining the two just so it gives you a better sense of whether or not you want to be a psych nurse or not. I know more and more people are actually leaning towards becoming psych nurse practitioners, but I always say make sure you get your psych experience just so you have a better understanding of whether or not you like dealing with this top population of patients, because not everyone loves psych nursing. So if you know you're not going to really necessarily like psych nursing, then maybe becoming a psych nurse practitioner might not be the best idea, even though you want to be able to make an impact. And I go over a lot of these positives in all my other videos. But maybe you guys have to just kind of dabble with getting a psych nurse experience just so you have that experience and understand if it's right for you. There's so many pros and cons of so many different jobs out there, but you always have to outweigh the pros versus the cons. The beauty about nursing is you're able to go from specialty to specialty without necessarily having to do more school. Besides the fact of nurse practitioners where you do have to specialize and get more schooling. But for the most part, as an RN or LVN, you typically will just do the work and you get to go to different specialties without getting more coursework. All you need is kind of that experience and someone to train you. But for the most part, there's so many different pros and cons, and I figured I'd just go over the pros and cons of being a psych nurse just so you have an understanding of what we do, what the pros are, what the cons are, and then from there you'll be able to outweigh the risk, benefits, and then also the alternatives to nursing. So without further ado, let's go over the pros and cons of being a psych nurse. So before we get started, make sure you stay until the very end of the video because I do go over the cons of being a psych nurse and the most important con, especially towards the end. So you want to make sure you stay until the very end of the video to be able to see all the pros, be able to see all the cons, just so you have a better determination on if psych nursing is for you. So let's get started. So the very first pro of being a psych nurse is you get to develop your critical thinking skills. So the beauty about being a psych nurse is that you're able to develop these skills. You get to determine how you want to provide care because you have such a large amount of patients within that small setting. So depending on where you live, for example, as a psych nurse in California, the ratio is 1 nurse to 6 patients. So you have to be able to take care of all of these patients, and depending on their acuity, depending on how many medications they have, and depending on if they go off and have to require some emergency medications or restraints, you have to be able to juggle all of these things and be able to provide the quality of care necessary in order for them to feel better. So you always have to develop these critical thinking skills in determining who you want to treat first, how you want to treat them, how you should adjust your style of communication for them in order for you to make sure that you have a smooth shift, one, and then make sure that you are having an environment that's conducive for them to actually heal. So you always have to think about that when you're thinking about a pro of being a psych nurse. So the second pro of being a psych nurse is the fact that you get to develop your communication skills. So these communication skills that you're going to develop when being a psych nurse, you can take it anywhere you go. If you want to be a doctor, if you want to be a PA, if you want to be an NP, if you want to go in business, if you want to go in law, you're going to be able to take all of these communication skills that you've learned in psych nursing and be able to apply it to so many different areas of your life, just because you get to learn behaviors and you get to learn how to talk to people with certain behaviors, certain disorders, certain just anything. You're going to be able to understand. You're going to be able to understand when it's appropriate to use certain communication skills when it comes to patients that are anxious, when it comes to patients that are aggressive, when it comes to patients that are irritable. So you always have to consider that the communication skills that you're going to learn in this unit, you're going to be able to take that with you for the rest of your life, and you're going to be able to adjust accordingly based on the person. If someone's aggressive and acting out on you, you're going to understand how to de-escalate them. Or when someone is depressed and low and that kind of needs that communication skills of being able to just be there and talk to them, then you're going to understand when it's appropriate and how appropriate your communication skills can apply towards that. So you can take this anywhere you go, and I truly believe that the communication skills that I learned within psych nursing has put me forward in my life, regardless of being a Psych NP, just being in the home setting that also helps me there. So the third pro of being a psych nurse is you get to build therapeutic alliances with patients. So this is extremely important because when you build therapeutic alliances, you get to be able to use the therapeutic communication skills that you learn in order for you to build these alliances with patients. So this is extremely important because you get to be able to take this skill and take it beyond nursing. So this is extremely important because if you're able to build this alliance with patients that have multiple disorders and that are aggressive, irritable, depressed, anxious, then you'll be able to build alliances outside of work, so you'll be able to be portrayed as confident and being able to talk to people, be able to develop these relationships with people that are going to take you beyond nursing. So developing these alliances are important. So the fourth pro of being a psych nurse is you get to be able to de-escalate patients. So not only verbally, but you get to learn how to de-escalate patients when you have to use physical maneuvers. So that's important because in the real world, you get be able to take these skills in order for you to de-escalate patients outside of work, and then also be able to de-escalate patients in any type of setting. So this is extremely important when thinking about skills beyond just nursing. I know this is just meant for nursing, but at the same time, you get to be able to take these skills that you learn in the psych unit and also use it in the ICU, ER, med-surg, and so many different places. You'll be able to use these skills. So the fifth and final pro of being a psych nurse is you get to take all of these skills combined and use it to further your career. So this is extremely important because when I took all of these skills, I was able to apply them and be able to be successful in the ER. You get to be able to learn critical thinking skills. You get to learn communication skills. You get to be able to build therapeutic alliances. And you get to be able to de-escalate patients whenever they're being aggressive or verbally aggressive. So this is extremely important because I was able to take this wherever I went. When I started my first career job as a nurse practitioner, I was able to use that. I was able to use it during clinicals. I was able to use it in the ER, in the ICU. You're able to use all of these things to better your career. Not only do you get to better your career within the psych world, but also within just the nursing and medical world. So you always have to think about the long run, the bigger picture, because a lot of people think about just these small, minute goals, but you have to think about the larger picture. And by being able to develop all of these skills within the psych unit, it's going to take you way further than you would expect. So now that we've went over the pros, I wanted to go over the cons. And honestly, these cons are kind of iffy, but at the same time, it's certain things that people think about psych nurses, and you always have to consider these things as cons because they're going to come up. Whether you're going to be the best psych nurse or the worst psych nurse, these things are going to come up. So without further ado, let's go over the cons. So the very first con of being a psych nurse is the community of nurses, they're going to think you're either lazy or crazy. And this kind of disrespectful, But at the same time, you always have to think about that things when you are becoming a psych nurse. They're going to think you're lazy because you're not necessarily using the same skills that they're using. But like I mentioned in previous reasons, we use so many different skills that they don't even know how to do. They don't know how to be able to de-escalate someone physically and being able to de-escalate someone with their words. They're not going to be able to do that. Yes, they're going to be like, oh, I can put in an IV, I know how to do wound care, but anyone can do that. You can list off instructions and you'll be able to do that. But therapeutically helping patients, that's a whole different ballgame. And on our end, it's a lot harder because you have to be able to use the certain treatment modalities in order for you to help them. You have to be able to adjust on the fly to be able to help a depressed patient compared to a manic patient, help a depressed patient compared to an anxious person. So you always have to be able to use these skills. So I don't know where they came up with this idea that we're lazy, because at the end of the day, we're going to be doing a lot more things that's mentally wearing on our bodies compared to the physical labor. I can understand where they think that, but at the same time, it's a lot different in this case. And when it comes to thinking that we're crazy, yes, there's some people that can develop tendencies depending on their own mental stability when it comes to dealing with so many mental illness. But at the same time, it's not like we're automatically going to become crazy. So definitely think about that, because these are huge cons when it comes to being a psych nurse. So the second con of being a psych nurse is you're going to receive a lack of gratitude from patients. And unfortunately, it's one of those things where as psych nurses, you're getting patients at their worst state depending on which facility you work at. Typically in hospitals, in those higher acuity settings, you're going to be getting patients that are extremely irritable, aggressive, manic, psychotic, and they may not give you as much gratitude as a person working in the ER or the ICU or med-surg, especially when you don't necessarily get to see them at their best state. A lot of the times they don't even want to be in the hospital, so they're not going to necessarily be more forthcoming in terms of thanking you for being able to take care of them. Like I said, in other settings, you are going to get that. They're going to come back to you, give you food, give you hugs, give you praise, gift cards, or whatever they want to give you, but they're going to be thankful for that. But within the psych world, more than likely, you're not going to be able to receive that. Some one-offs you're able to, especially as a psych nurse, but typically they don't necessarily give you as much praise as you deserve. So the third con of being a psych nurse is the emotional stress involved in our job. So dealing with patients that have all of these behaviors, whether it's psychotic behaviors, manic behaviors, depressive behaviors, anxiety behaviors, you're going to be dealing with people that are being able to display all of these things based off their words and how they're acting. So when you're dealing with this every single day, sometimes 12-hour shifts, sometimes 8-hour shifts, Monday through Friday, 3 days a week, 5 days a week, whatever it may be, more and more of hearing about this is going to be emotionally stressful for yourself. So you always have to think about it, because hearing every single thing about how suicidal one is, how depressed they are, how they have low energy, and just being around all of this low energy, low motivation, and just these certain behaviors is going to be emotionally stressful for yourself. So I always suggest making sure that you recognize this, and you have to understand that with this job, it's stressful. It's going to take so much on yourself, physically, mentally, so you always have to think about the emotional stress that it comes with this job. So the fourth con of being a psych nurse is you may get physically hurt. Not in all circumstances, but you have to think about the circumstances that you're in, especially when dealing with aggressive, irate, irritable, psychotic, manic people. And unfortunately, they're not necessarily in their normal state of mind. And unfortunately, there may be instances where they display these aggressive behaviors, and you have to be able to de-escalate them appropriately. And sometimes you may physically get hit, punched, kicked, spit at. And unfortunately, I've been in those situations, and I've got hit, spit, punched, all of these things, and you have to be aware of it. And if you feel that this is kind of the thing that you don't want to actually experience, then you might have to think about another career in a different specialty. I'm not saying it's going to happen every single day, but you have to always consider that there's an opportunity for this to happen, and you have to be aware of that. But luckily, you are learning ways to de-escalate patients, and you're able to use some of these maneuvers in order for you to escape safely. So the fifth and final con of being a psych nurse is typically you'll get lower pay compared to all of the other specialties. So when you're thinking about emergency, when you're thinking about ICU, L&D, all of those different specialties, more than likely you're gonna get way less pay. And unfortunately, that's the case when it comes to nursing. And unfortunately, I don't know why, because we deserve hazard pay, one, just because there have been instances where we get kicked, punched, spit at, all of these things, and they have to consider that what we're doing is a little bit different, although it's not as busy, so to speak, but there are moments where it's extremely busy, especially when it comes to taking care of all of these patients, when multiple patients are going off and not necessarily having adequate staff. So you always have to take this in consideration, and unfortunately we do get paid a lot lower compared to all the other specialties. So this is a huge con, and maybe that's why a lot of patients, or nurses why a lot of nurses aren't necessarily going into psych, because of how low the pay is compared to all the other specialties. And that's where everyone wants to go towards, especially when people want to make more money. Then they go towards ICU, ER, and then a lot of people go ICU, so they become CRNAs. But it's one of those things that you always have to consider, especially when choosing career. It is, although it is a huge con, but all the skills that you're going to be able to learn and all the pros that you're going to be able to have, you'll be able to take it further in your career to actually be part of the patient, or be part of the population where you do get paid a lot. So it's always something to consider. You always have to think about the cons of it in the beginning, but you'll be able to reap the benefits later on in terms of being able to use these skills outside of nursing, or even in nursing, to further your career. Well, guys, I hope you guys enjoyed this video. I hope it gave you a better sense of the pros and cons. Obviously, it's not going to be all of the pros and not all of the cons, but for the most part, I hope it opens up your eyes and gets your mind, your wheels turning in terms of whether or not this is going to be appropriate for you. And like I mentioned, being a psych nurse is a skill. It's one of those things where not many people can do it. So if you're able to do it, I definitely applaud you. Keep on doing the things that you're doing. Keep on working hard and working towards whatever goals you want to work towards. But yeah, as always, guys, I hope you have a wonderful day. I hope this helped you learn more about being a psych nurse. And if you have any questions or concerns, please leave a comment down below. Feel free to email me. Feel free to DM me on Instagram. And yeah, as always, guys, have a wonderful day. Until next time, bye.